Good evening, and thank you for joining our COVID-19 vaccine town hall. Getting to yes. I am delighted this evening to introduce our moderator for this session, Vanessa Dolrez Nazir. Vanessa is the Director of Government Programs and Contract Quality Performance for Cambridge Health Alliance. She sits in the quality department where we have gotten to know each other quite well over the recent months. Vanessa is a responsible individual who oversees, supports, and coordinates a variety of quality and delivery projects associated with transformation and innovation under our Massachusetts Medicaid waiver program and contracts associated with our accountable care partnerships. Vanessa fosters an environment of collaboration. She has been instrumental in CHA's success with waiver projects and in implementing the palliative care program. Vanessa received her master's degree in public health from the Mass College of Pharmacy and Health Sciences. And most importantly, she is a mother of 2 young boys. I am delighted to have Vanessa moderate this Q&A session to demystify COVID vaccines. As a Haitian American, she is committed to debunking myths and improving vaccine uptake among our staff and patients in our communities. Vanessa.
Thank you, Luann, for the nice introduction. So thank you everybody for being here tonight. We're very excited to have these 6 panelists who are here with us tonight to share their experiences with the COVID-19 vaccine and how they overcame their sort of hesitancy around that. As Luann mentioned, I'll be the moderator for the session tonight. So the flow of the evening is pretty much going to be a brief introductions from each panelist. And we'll have some questions that will be directed to each panelist. And most importantly, we want to hear from the audience with questions. And so given that this is a virtual event, we could either start putting questions in the chat or raising our hand, and we'll have Luann sort of monitor the chat box. And feel free to interrupt if you have a question in between. We really want this to be interactive, informative for our audience. So with that said, I think we can go ahead and get started with the introductions with the 6 panelists. So we can start off by introducing each of them. And so if they can state what they do and what ethnic background they're from, that would be very helpful. So we can start off with Caroline.
Oh, sure. So my name is Caroline Bowen. I'm a PACU nurse. I am Brazilian, and I'm currently pregnant, which I think is important to know when it comes to COVID vaccine.
Next, Sovali.
Yes, my name is Sylvie Forrestal. I work for CHA for 15 years at Medical Specialties in Cambridge. I'm a Christian, and I was born in Haiti.
Dr. Payne.
I'm Dr. Michael Payne. I'm a clinical gastroenterologist at the Cambridge Health Alliance. I'm also a master's in public health. It's a pleasure to be here this morning or this afternoon with you.
Dr. Graves.
Hi, everybody. I'm Dr. Agnes Graves. I am a primary care physician. I work at the Windsor Street Health Center. I also trained in internal medicine at the Cambridge Health Alliance. I've been with the Alliance since 2003, and I was born and raised in Ghana. Came here to attend college and medical school, and I've been here since.
Elisa?
Hi, I am Elisa Tristan Chivo. I'm in the infection prevention liaison here at CHA. I'm a physician by training, public health advocate, and in the community, I'm the vice president of the Council of Brazilian Citizens. I was born in Panama, but I also have Brazilian, so I speak Spanish and Portuguese.
Thank you, Lisa. Last but not least, Casey. Oh, actually, David. Sorry, I'm looking at Casey.
Hi, my name is David Alexandri. I'm also Brazilian. I am married to a wonderful woman, 2 kids, and I am pastor at Connection Church in Lynn. And I've been working with the most vulnerable community for about 2 or 3 years. And that's it.
thank you all for introducing yourselves, and thank you again for being here tonight. So we'll get started with some questions that we'll be asking each of the panelists to respond to. So the first question that we would like to have everybody respond to is, what motivated you to get vaccinated? So we can start off in the same order. So that would be Caroline.
Okay. So to me, it was really important to take the vaccine to begin with. But then right before the vaccine came out, I found that I was pregnant. So at first I was a little skeptical about taking the vaccine. I wasn't sure if it was safe or not. And I did a lot of research and kind of decided that it was more important for me to take the vaccine than not. My research has shown that people that are pregnant tend to get sicker than they normally would if they get COVID. I normally don't see anybody outside of work, so my exposure is close to zero outside of work. But since we work with patients, even though we wear masks and we're safe, there's always a chance, because it just takes that one person to catch it. So I decided that it was important to me to make sure that I was keeping myself and my baby safe. So that's why I decided to take it.
Thank you. Dr. Payne, you want to go next?
Yeah, please. My apologies, but I'm actually at a hospital with a loved one in Chicago, Illinois, which is where I'm from. I forgot to mention, by the way, I'm African American. The reason that I think it's important for us to get people vaccinated is that we have 501,000 people in this country who have died from this infection. When people talk about potential side effects, we're talking about things which potentially could hurt 1 in a million. Allergic reactions. The majority of the side effects are minimal: a sore arm, flu-like sensation that lasts for a day or two. If you get COVID, there is about a 10% to 20% chance you're going to get hospitalized. And there's about a 1 to 2% chance that you're going to die. So in terms of risk-benefit, it's really important to remember that, yes, there's no such thing in this world as a risk-free environment. Everything has a risk. Driving to work has a risk of being in a car accident. Taking a shower in the morning, there's a risk you could fall and break your neck. Getting a vaccination has some small risk associated with it. But the risk of not getting it and the almost certainty of eventually getting COVID, because the virus is not going away any more than polio or diphtheria or tetanus has gone away. But we don't see a lot of deaths from those because people get vaccinated. I really wanted to make this call. As I said, I'm at Billings Hospital with my cousin who is ill. I'll try to loop in later, but I cannot impress upon you, we do not need any more dead bodies. Perhaps you see these if you're working at CHA, you know how many deaths we've seen. Please don't become one of them.
Thank you. David, would you like to go next?
Yes. In the beginning, I was a little skeptical to take the vaccine because of the wrong information that I was receiving. But what made me pretty much change my mind was I talked to my wife a lot about it, and she helped me to understand. I read about the vaccine, and I realized that the vaccine is pretty good thing that happened. And the other thing that also made me change my mind was my colleague. He lost 3 brothers in the period of, I'll say, 2 to 3 months, and that was a real reality check for me. It became real, became very real and very close to me. And seeing my kids, the people at my church, I thought that they deserve to be safe, and I don't want to be the one carrying a virus that I didn't even know that I had if I was asymptomatic. So I decided to take the vaccine to make people safe, people that I love, people that I'm next to.
Thank you, David. Dr. Agnes?
Yes. So I was eager to get vaccinated. By the time the vaccine rollout came upon us, I was excited. I felt so lucky that I was among the first few to get vaccinated. I had no doubts that I would get vaccinated. And I did it because I wanted to protect myself. I wanted to protect my patients. I wanted to go to work and not be afraid of catching something, getting ill, and even worse, bringing it home to my family. I'm tired of living this way. This really is no way to live. I want to go back to whatever the new normal is after this pandemic is over. I've lost many patients to this pandemic, to this virus. Many that I haven't even come to terms with it. I haven't been able to allow myself to think about it because I have to keep going. You know, I believe in vaccines. As a primary care physician, I'm all about prevention. I'm constantly on my patients to get their flu shots and get booster doses for all their vaccines. And I had to practice what I preach. And for me, that was not a difficult decision at all. I needed to do it, and I'm glad I did. And growing up in Ghana and for several African countries, generations of people wouldn't be alive and doing well today were it not for vaccines. So I don't need much convincing to get vaccinated. And I just hope that our colleagues watching us today or hearing us will consider getting vaccinated after they hear us.
Thank you, Dr. Graves. And Elisa, would you like to go next?
Yes, I would like to say that I got vaccinated because I strongly believe that, it's a civic duty. And I was doing this not just, for me or my family, but to protect my community. And I'm coming from Brazil, a country with successful history of mass vaccination campaigns. And I know, and we have proof that vaccines do save lives. I lost family in Panama. I lost friends in Brazil. And I know that this vaccine is crucial for us to control this pandemic.
Thank you all. So I'd like to move on to the next question. As you know, there's a lot of skepticism and myths related to this vaccine that's likely contributing to some of the hesitancy of taking this vaccine. So for each panelist, what doubts did you have initially and what changed your position in getting vaccinated? And we can start off with Caroline.
Okay. So for me, the first question I had is whether or not it would be safe for me and the baby to be receiving this vaccine, just because there's not a lot of research out there. So we pretty much did all the research that I could and got a lot of information from the hospital itself about what's the recommendation, and kind of decided that the benefits outweighed the risks, although they have not seen much of any risks with pregnant women so far. I just got from Dr. Bruno Murtha a new study that came out that says that the new research says that 78% of the babies that were born with women that had antibodies on their system, the babies will also had the immunity. So it's kind of exciting to me to know that there's a chance that my baby will be immune, especially for a few months in the beginning when they're newborn and they're more at risk, knowing that they'll be hopefully safer than they would be otherwise, seeing other people and being, coming into the hospital for appointments. So that's a really good thing that I learned. The other thing as well is I've heard that people have been talking about the vaccine not being safe for a pregnant woman, that it can cause abortion, and that is a myth. So I'm glad that I never came across that myself, and that was not one of the reasons why I didn't do it, but I really want people to know that it's not the case. There's no research that shows that women can get miscarriage after getting the vaccine, but they can get much sicker if they do get COVID. So that's why I decided that it was a way better chance for me to get the vaccine than, to get COVID itself.
Thank you. David, would you like to go next?
Yes. So I did have a lot of doubts in the beginning. Like I said, I am Brazilian. I am around Brazilians all the time, and it's very common on WhatsApp. We receive videos of some guy saying things that gives you like a little doubt. And I remember that one of the things that they were talking about, a bunch of videos that I received, was that the vaccine could change your DNA. It could, if you didn't have kids yet, your kids could, be born with some defects and this and that. And that was a little scary because I didn't know much about the vaccine. The other thing that I heard too was that it is impossible to a good vaccine to be ready in 1 year. That was very strong points that made me have doubts, have a little doubt about the vaccine. And also the president of Brazil, he thinks the same thing, the same way the former president of the United States thinks that the COVID is just a little cold and you are okay, you're going to be fine. And you always think that a very powerful man saying those things, he probably has information that we don't. So that gives you like a little cold feet. Like you don't know if that's really safe. So that was the reasons why I was a little doubtful in the beginning. And that what made me change my mind was education. I read about it and I learned. And the other side too was fear. Seeing my colleague losing 3 brothers made me realize that this is real, and that's why I changed my mind and I got vaccinated.
Thank you, David. Sylvie, would you like to go next?
Yes. Yes, I had some initial doubts about the vaccine. However, those doubts was not so much on the quality of or the efficacy of the health community, but more on the historical, cultural, and racial prejudice of institutions using Black and Brown communities as test subjects without their consent. And in some cases, to use them in adverse ways under the ploy of health and safety measures. In addition, I was questioning the short period for the vaccine to be available, especially since it is said that it takes years for a vaccine to be developed, approved, and available to the public. However, I agree with the fact that due to the emergency situation, the government created avenues to make the vaccine available in a short period.
Thank you, Sylvie. So I think Dr. Payne left us, so sorry about that. So as you know, a lot of us who've taken the vaccine, we've sort of had some side effects, and we would like to sort of be honest with what that looks like for everybody, so we can kind of share what side effects that you experienced after taking the vaccine. David, did you want to respond first on that?
Yes. I got my second dose yesterday, 10 a.m. And I remember the first dose for me was a little bit more, like, made me a little bit more sore than now. And yesterday the nurse told me that I would probably get some side effects and fever, but no, I'm fine. To be honest, the second one was easier than the first one for me. And I don't even want to say that I'm a little sore. I'm fine. I didn't have any side effect, thank God. Everything's good.
Thank you. And Elisa?
Yes, with my first dose, what I had is what I usually have when I have, any vaccine. So no worse. So I had lower fever, a little bit of body aches, and I took Tylenol, and everything, disappeared. With my second dose, I only had like a sore arm for 1 day, and that's it. One thing that I would like to add that I saw, Pastor Alexandri is saying is, the people think that we can change our DNA if we receive the vaccine. It's a myth. And then, in videos and not coming from a really trust source can cause, a bad impact in people's minds. And for you that are, here with us, they don't change, the vaccines don't change your DNA. Vaccines, the people have been working with vaccine for decades, many, many years. And it's not just because of this type of coronavirus. They have been working with coronaviruses for a long time. So it's only just for you, it's one of the myths that we see in the community. And also they can change your body. We saw, some videos making people change to a alligator, or maybe, start dancing in a different way. But it's just a myth.
Thank you, Elisa. Dr. Graves?
Yes, I got the Moderna vaccine, and after the first dose, I had some soreness where the vaccine went into my arm, and that was about it. The second dose, I felt more symptoms following that. I had some fatigue and weakness the night of the vaccine itself, and the following day, I had some body aches and pains and some soreness in the arm as well. I took the vaccine on a Thursday morning, and by Saturday, I was fine. But I think it's important for us to let patients know that they may develop some symptoms, no different from some other vaccines that we receive. Some people will experience symptoms with the flu shot, for instance, and it's not anything to worry about. It's a sign of your body doing exactly what it's supposed to do, which is building antibodies, mounting an immune response is what we call it. So you're making antibodies against the virus. And in fact, this COVID vaccine does not contain virus. That's one thing I think we need to make clear. There is no virus in this. You're not going to get COVID from getting the vaccine. All the vaccine contains is information in the form of messenger RNA that prompts the body to produce the antibodies so that when you do get exposed, or if you get exposed, your body will be ready to fight the infection. And the vaccine never enters your DNA, as Alyssa said. Your DNA lives in a part of your cell called the nucleus. Proteins are made in a different part of the cell called the cytoplasm. So you can think of, let's say, a fried egg. And so fried egg with the yolk intact. The yolk is your nucleus. That's where your DNA is. And the white of the egg is your cytoplasm. That's where proteins are made. The vaccine goes into your cytoplasm, and that's where it stays. Never changes your DNA. And as you can see, all of us look well after having received the vaccine. We haven't grown any extra appendages. We're fine. Whatever side effect I would have had after the vaccine, it still is better than to risk getting sick and worse, right? We all see the images on TV, and early this week, we mourned the loss of 500,000 people. 500,000 people in only 1 year. If that doesn't move you, I don't know what will. This thing is real. This thing is real, and now we're seeing variants come out. The sooner you get the vaccine, the sooner you get protected, the better. Don't wait. Please don't wait.
Thank you, Dr. Graves. Caroline?
I've only received my first vaccine, and I had a little bit of sore arm, just like you would with any other vaccines for that. And I'm due for my second vaccine on the 10th.
Thank you all. So, of course, this is targeted to our employees, and so we're trying to encourage folks to reconsider vaccination. And so, to each of the panelists, how do we think we can improve vaccine acceptance? We can start off with Elisa.
Okay, I think this applies not just for our, colleagues, our, CHA employees. We are talking about the community in general. I think we need to have a better collaboration between healthcare, government, the community organizations, and I'm going to say especially the media, and to try to highlight the positive impact of the vaccine, and not just to emphasize the bad outcomes and what we see every day. And they put a lot of attention, bring a lot of attention on those rare episodes of severe side effects. As the Dr. Graves said, we can have side effects, but are minors, and things that we can deal with. And another thing that I think having members of the community and patients who already are fully vaccinated, sharing their experiences, I think that this can help a lot, increase trust, especially among minorities.
Thank you, Elisa.
Mhm.
David, would like to go next?
Sure. I think definitely more education, like I think was Dr. Graves explained very well, using the egg as an example. Very easy way for people to understand, because if you don't want to take the vaccine, there is a reason. Usually it's because you don't trust in it or something related to that. And once you get that information and you learn about it, it's easier for you to make that decision and actually be vaccinated. So that's what I think. I think should be more education towards focused on the vaccine itself and how it works. And that would be the best way.
So David, I know you're the unique person on this panel as being a pastor. Could you just share what you're hearing in the community related to this vaccine and how you were able to sort of help educate those members?
Sure. I've been hearing a lot. The problem is people, they tend to believe on that person that say the wrong thing. I don't know why, but I've heard that I've heard a lot of things. I heard that we are being guinea pigs. They are trying on us, and being like a minority, they don't want us. They don't care about the minority, so that's why they are trying this out. Do you know any rich people that got the vaccine? Those type of conversations been going a lot. And the other thing too is they always know someone that got COVID and was either asymptomatic or had like a little fever or this or that, and they say that it's gonna happen to them and it's not a big deal. And that's what I've been hearing a lot. People, they don't want to risk it because it's just a cold.
Thank you. It looks like we're getting some questions, and I guess Sovali, maybe you can address this question. And I know you and I come from the same culture in the Haitian community. So what, from your perspective, would help trying to encourage vaccination in the Haitian community?
I think for now, education is key. And I was thinking about doing the same thing in their language, in Haitian Creole, and also the churches, because they are very reluctant for the members to have the vaccine. So we need to do education. And also, as David mentioned, WhatsApp, Facebook, so all these platforms, they're not really trusted, like, to get the information. So I think the community, they need to go to CDC website, WHO website to get the real information. And also talk to your doctor, talk to your provider, so the provider can help you, can answer your questions. Because some people, you go to them, they have negative information about the vaccine, so they won't give you they won't encourage you to get the vaccine. So I think education is key now for the population so they can get the vaccination.
Thank you, Sovali. I think that's important. I think what we're sort of seeing in the research is that a lot of people are trusting their providers for information. So I think that's important to encourage. So folks have questions, we definitely encourage everybody to go to their provider. Dr. Graves, you would like to go next?
Yes, I absolutely agree with you, Sovali. In the last month or so, every time I speak with a patient, I make sure to ask about their plans for the vaccine And if they have any questions, I take some time to address it. I've actually been very pleasantly surprised. Many of my patients, like most of them, are eager to get vaccinated or have got vaccinated already. So that's really great. That's very encouraging. But for those of you who still have questions and still have doubts, I absolutely encourage you to speak with your primary care physicians about it. Speak with your providers, your nurse practitioners, your physician assistants, the MAs in the clinics. Talk to them, people who do believe in the vaccine and have received it. Talk to them about their experiences. There's nothing like personal experience in trying to get information about this vaccine. We're here, to encourage you to get it. We're here to help you. We're here to help all of us. This is the kind of illness in which what you do affects me and what I do affects you. We can't be individualistic about this. We have to do this together, all of us at the same time. The sooner we do it, the sooner we can get over this. So by all means, please talk to us. And then for those of us on social media, when you do get the vaccine, share the information with your friends. Let them see you get the shot. Let them see that you're okay, that you're doing fine after having received the vaccine. And I think all of that hopefully will encourage people to get vaccinated.
Thank you, Dr. Graves. Caroline?
I think for staff-wise, it's really important to talk to the people who that do not want the vaccine and see why, because I think each person might have their own different reason why. So it's hard to kind of pinpoint what's causing them not to take the vaccine. So I think I agree with not only encouraging everybody to talk to their primary care doctor about it, but also trying to figure out why they're not willing to take it. If it is because of an allergy, is it because they don't think it's important enough? And I think that we can that way try to convince more people to wanting to take the vaccine.
Thank you. And Elisa?
I want to just add the importance of sharing your experience. I have, my parents. I want my parents alive and healthy. My father yesterday lost, his cousin in Panama. So the first thing that I did was to, take a picture and share with the whole family, saying my father is here, my father is doing well. And I think, sharing the good experiences, especially seeing our patients, our elderly, doing well, I think is very powerful.
Thank you.
Vanessa,
Yep.
would you share your story with us, please?
Sure. So I got vaccinated, just as many of you already shared, is that I was also hesitant with getting the vaccine and did a lot of research and education, and then decided to get vaccinated. And I also, another reason why I got vaccinated was simply because, like some of you all, I lost a lot of family during the pandemic, especially during the height of the surge. In the matter of 2 weeks, we lost several family members to COVID-19. And so just witnessing what the virus can do to the body in a matter of a week and a half to my grandparents was very hard to see. And so I think all of us kind of realized that this virus was not going to go away. And the only way to protect ourselves is to get vaccinated. So I'm actually the first person in my family to get vaccinated. I am still trying to encourage my family members who continue to remain hesitant of taking this vaccine, but I think we're almost there in getting them vaccinated, because I do have a lot of high-risk family members who should be in line of taking this vaccine because of their conditions. And so I think for me, it was just the experience of all the loss that I had in my family, and just witnessing what this virus can do to the body. As Dr. Graves said, this virus is real, and witnessing it is even real. So I did not want to see any of the rest of my family members or me be the reason why somebody gets sick. And so that was my reason for getting vaccinated. And I think some of my hesitation was really about again, what everybody said, the quick turnaround in terms of getting the vaccine developed, and also whether or not, if there was actual people of color in the vaccine trials. It wasn't clear to me whether that actually happened or not. And so I did some education and research and found that that was the case. So that also changed my mind. And I know in the past we've as a person of color, there's just a lot of distrust with the system in general with healthcare. So I think a lot of that contributed as well to my hesitancy. But again, I think it took a lot of education and comfort and kind of almost as a wait and see to see how this would work. And so that was a lot of sort of why I was hesitant, but realized it's better than sitting in a hospital and, you know, on machines and really, really sick. So for me, I think that was important for me to get vaccinated. So this is, looks like we have some questions. Ooh, okay.
Yep, I'll read some questions for that came in. So a great question from Anita. For those CHA staff members who have chosen to opt out of vaccination for their own reasons, how should we as their colleagues approach them to not dissuade patients and fellow employees from seeking the vaccine? Any suggestions from any of our panelists?
I'll go for it. I hope that my colleagues in my clinic who I've known for several years and who are like family to me, I hope that they will receive it openly if I approach them. You know, if I hear that they're hesitant about getting the vaccine, I think I would want to approach them and find out if there's anything I can do or anything I can share from my experiences and from my medical knowledge that will change their mind about the vaccine. And I don't expect that for some of my colleagues that it will happen overnight. But I think if we approach this with humility and compassion and an understanding for the fears that they have, we'll go a long way in trying to convince people to get this vaccine. I would hate for them to feel ostracized because they decided not to get the vaccine. We are all in this together, and we have to work together to overcome this. So that, I think, would be my approach.
And I agree with Dr. Graves. I think it's very important, you know, if you have any question, if you want, you know, us, you know, to help, you know, in some way, please let us know. We are here. Maybe we can know a little bit more, or maybe we don't know. We're gonna refer you to the right person to, you know, to have all your questions answered. I think it's very important.
Any other panelists have any response they want to provide?
What are we doing in my church? We've been talking about vaccinating a lot. My wife and I, we sometimes after service or on Wednesday that we do the food bank distribution, we save a little time to talk outside about it. And I've realized that it worked. We have many families that every week that they go there, they ask my wife, when is it going to become available for the general population? People that were not going to take it before, but now they are. It was just a little bit of information and a little bit of experience. You share your experience, you say that's not what people are saying out there, and they ask questions, you answer, and I've seen that it's working good, that approach that we are doing.
Okay, we have another question from Vanessa. Many employees have said that they face opposition to vaccination from their family members, both here and abroad. Some of them have actually been vaccinated in secret. What advice do you have to talking to friends and family about your personal decision to be vaccinated?
Thank you, Vanessa, for that question. I could actually relate to that. When I first got my first dose of vaccination, and I actually posted my vaccination on both my Instagram and my Facebook, and the amount of responses from my own circle of friends and family was really what did you do? Are you crazy? Are you, and just all these comments, and wasn't really encouraging, but everybody just felt like, why do you trust the system to get vaccinated? Why are you doing it so quick? I got millions of questions. And so I sort of had to turn everything off. And then as to your question is like, what can you do to help, share your experience? And so that was kind of what I did. I shared my experience of, I don't want to lose anybody anymore in my family. I don't want to, go to any more funerals. I just don't want to see anybody sick. I see what this virus can do to the body and how you can, lose your life in a matter of days. And so I don't want to experience that again. And so for me, that was what I had to say to a lot of people. And I think, some people, agreed and said, I don't want to get sick either. And I think that kind of resonated with a lot of people, because I know a lot of people who were skeptical also lost family. And so I think for them, just losing family was very eye-opening and really motivated people to reconsider. And so I think for me, it was really just sharing the loss and not wanting to see continued deaths in our families.
Thank you, Vanessa. A comment from Avlo. One of the strategies that worked for me prior to taking the vaccine was to make a deliberate choice to interact more with people who had taken the vaccine or were more pro-vaccination versus people that were against it. After I took both doses, I made it a point to encourage others to take the vaccine. I do have a sister who works in healthcare who's on the fence, and I continue my outreach to her. And that's great, Avlo. That's what we should do. We should give people time, continue to speak with them, hear them out, and try and address their concerns, but listen to them and see if you can understand why they're hesitant. And with time, I think a lot of people will come around and accept the vaccine. Another comment from Anita. Thank you, Avlo. I worry that when I hear some of our staff say, no way, never going to take it, just hoping to find a tactful approach to encourage them to stand by their choice more quietly. Yeah. Another comment from Avlo. I lost a long-time Cambridge sport buddy to COVID-19 and almost lost a close family friend. I feel privileged to be working in healthcare and have access to a lot of information, and I find it gratifying to be in a position to share it with others. Thank you, Avla. That's a nice comment. I'd like to open it up to anyone who might want to speak or might want to verbalize a question.
I wanted to comment on this. That's one reason that many people have had for not wanting to get the vaccine, and which is that the vaccine was developed just in a matter of a year. And after doing my research and hearing from my colleagues, what I can share with you is that the technology with which the vaccine was made is not new. It actually has been around for quite a long time, this mRNA technology, right? Medicine and technology is now much more sophisticated than it ever was, right? So with the technology that they have, they were able to get this vaccine out and more efficiently and in a speedier manner than the vaccines we've had in the past. And in fact, mRNA technology is used not only in vaccines, it's actually used in cancer treatment as well. There's currently no licensed vaccines that are of mRNA technology, but there's research that's been going on for years using that technology for the flu virus and for Zika, among others, right? So it's not that anything was rushed. If I see patients and I'm comfortable prescribing medications that have been authorized, that have been monitored and that the FDA tells me is safe to prescribe to patients, I have no reason to think that the same agency that makes sure that we get safe vaccines wouldn't do the same for this COVID vaccine. And I think this vaccine is more important than any vaccine we'll ever take in our lifetime, right, with what's happening. And I think After practicing medicine for close to 15 years and being lucky enough to not see cases of tetanus and polio and all these illnesses we know about but which we don't see because of vaccination, I think it behooves us to do the same for generations that are coming after us. We don't want to be talking about this 5 years or 10 years from now. We want to do right by our community and our children and our children's children to get this done.
Thank you, Agnes.
Thank
Dr.
you.
Payne is back with us, Vanessa.
Yep, I see that. Go ahead.
Hi, I'm sorry to bother you guys. We managed to get out of the clinic because they wanted me to keep my mask on, appropriately so. One of the things I did want to mention was there has been a lot of discussion about, concerns about the Tuskegee study, and people keep bringing that up. The Tuskegee study was a study about 75 years ago in which African American men who had syphilis were divided into two groups, one of which did not receive treatment for the syphilis. And it was seen has been one of the most horrific episodes of just violation of medical ethics that's ever been. And they quote that as a reason why African Americans especially don't trust medicine. But here's the problem. For me, as an African American man, I feel like the racism that created that study is reaching through time, 75 years, to kill Black men and women today. The reality is that this vaccination is safe. I mean, as safe as any vaccine we have. It's being given to people who are African American, white, Hispanic, Native American, Asian, and we're seeing very good results with it. So we know that it works. And what I am truly concerned about is that because of really misinformation, people, African Americans, are once again being asked to get at the back of the bus, only they're doing it of their own choosing. Because as they realize, wait, this is safe because we have limited supplies, they're going to find that they are the people who are getting it, later and later. And the reality is that this condition is still killing. If you have not gotten vaccinated, you are still at risk. So the longer you're at risk, the higher the probability you're going to contract this and possibly die from it. And so, as I said, I find this the greatest of ironies. A racist act 75 years ago is still killing people today. As far as healthcare disparities, they set the cutoff in the state of Massachusetts, 75. Well, nationally, the average life expectancy for Black men is 73. So, again, we need to get people vaccinated.
Thank you.
So there's another question, Vanessa, from Taruna, that asking me to address the myth around the vaccine causing infertility. Apparently, her 17-year-old daughter was mentioning this, and it's a common myth among girls at the high school level. So I could certainly speak to this. This is a myth that was circulating on social media, indicating that the vaccine produces antibodies to a protein called synectin, which is critical for placental attachment. But there is no relationship between the spike protein that produces antibodies and synectin that's essential for the placenta. So it's a complete myth, and many scientists have debunked it. And it's circulating on social media. There's no evidence that antibodies to the spike protein lead to infertility whatsoever, or for that matter, for pregnancy loss. I don't know, Caroline, if you wanted to mention anything about that myth. Had you heard about that at all in your circles that you want to address?
I have not heard that from the people I know. I think the most concern that I've heard is people thinking that might cause them to have a miscarriage if they were already pregnant. But I was not aware of the myth of trying to get pregnant and not being able to do so.
Trials, in fact, a number of women actually got pregnant during the clinical trials. They weren't permitted in the trial if they were pregnant, but a number of women did get pregnant during the clinical trial. And there was no signal whatsoever in the mRNA vaccine trials of any harm. And the clinical studies, the developmental and teratogenicity studies, and these are studies that are done in animals, also showed no signal of harm. So it is a myth.
Agree.
And also, I would like to say everybody wants to go back to the normal life. Everybody wants to travel. Everybody wants to take vacation. But if we don't take the vaccine, so it's gonna be the same thing. We're gonna stay home. We can go on vacation because the kids, they need to go back to school. So if we have to have a normal life. So I think we need to take the vaccine because the vaccine is safe, but the COVID-19 is real and it kills. Yeah.
So there was a question from Lisa wondering if we are engaging schools and school nurses in our communities to help spread accurate information about vaccinations. Children often influence our parents. That's a good point, Lisa. I'd have to ask my community colleagues whether they have initiated any of those discussions, but since schools are largely not quite back in session yet, I'm not sure that effort has been put into place, but it's an excellent point. And then Noria has a comment. I'm hopeful that as the COVID cases keep going down, people that are against the vaccine will change their minds. Kate Harney entered a comment as of the end of January, 15,000 vaccinated pregnant women are being tracked by CDC, and that should also help with vaccine acceptance. I actually think that number is even higher now, Kate. I heard even double that recently. So that VSafe app is really a rich source of information. Another question, people who had COVID but were reluctant to get the vaccine to begin with are still refusing to get it. How can we offer reasons to vaccinate? What are the benefits? So, CDC and ACIP are recommending COVID vaccinations for even individuals who have had clinical COVID. Although they do have a little bit of time, they're probably safe from reinfection at least for 90 days. So we still have an opportunity to speak to those individuals. And there is information also starting to appear in the medical literature. It's not yet been accepted as standard, but there's information starting to appear that individuals that had previously been infected with COVID may only down the road need one vaccine as a booster, but that remains to be approved by the FDA. But a lot of information is emerging about this, so more to come on that. Antoinette mentions that I'm very grateful for this panel. Thank you for doing this. I was very hesitant, but now I'm feeling much better in getting vaccinated. It makes a difference to see the folks that look like me and can relate to me talk on this and have many valid points that speak to my background. The CHA going to offer more vaccine clinics for staff soon. Yes, I think Jane Bewley, do you want to mention the upcoming vaccine clinics that we plan to have?
Sure. We're going to be continuing in March. Next week, it's devoted to some other patients, but the week beginning the March 10th, we're going to continue with vaccines. So the 10th and the 12th, and then 2 every week till the 24th of March. And we'll send out that communication.
Thank you.
Thanks, Jane. Tina mentions, as a person that is diabetic, I got the Moderna vaccine, and if anyone is nervous about getting the vaccine and how it might affect their blood sugar, there was no issue. My sugar has been fine. And thank you, Tina, for sharing that, and thank you all for sharing some of your perspectives. It's really great.
And if anybody's concerned about health issues, we do have, we do monitor patients. We watch them for however long we need to. And if they need to go to the emergency department, we bring them that to the emergency department. But we've, we've been very fortunate. There have not been significant responses to this.
Lexi Ladd from our marketing group said that she's happy to reach out to our teen health center providers to this in high schools, Cambridge, Somerville, and Everett. Thanks, Lexi.
And adding to what Lexi said, it's very important what Pastor Alexandri has been doing in the community, because he can start this conversation with the teenagers and, and the children on his, on his church. And this is one thing that can be replicated to other, places. It's very important to have this, as a champion, our faith leaders. Very important for the community.
Another comment, are we considering a campaign for reaching out to recuperating CHA COVID-19 patients? And then once we get the go-ahead, once again, with supplies to vaccinate more patients in the coming months. We are eagerly anxious to get all our patients vaccinated. Some of our anxiety has to be tempered with our supplies, and that's a little bit unknown from day to day, but we will be pushing ahead, similar to what we're doing with our staff with education efforts, to really get our patients to accept the vaccine. We need to achieve herd immunity to get back to our normal life, and that includes staff, it includes our patients, and it includes our community. So we are all gung-ho to do that. Casey has a comment. As a vaccine nurse, I haven't seen any allergic reactions at all. It's been really wonderful to be part of it. Thank you, Casey. Lisa, thanks for all the thoughtful information, ideas, and comments in this panel. I got my first vaccine dose on January 10th after doing my research about my own personal health concerns, but I decided to get the vaccine to help the greater good. COVID really demonstrates how we are all connected and how our individual actions impact others near and wide. That is so true. I'm very grateful to take the next steps forward in vaccination with the wonderful CHA community. Thanks, Lisa, for sharing that.
Thank you, Lisa. So we're coming to the hour. So thank you all for the questions and comments. This was really nice to hear. So we just have any final remarks from our panelists as we close out the night? Go for it.
We live in extraordinary times. Nothing like this has occurred in your lifespan unless you're 120 years of age. People didn't know what to do. And a real shout out to the scientists, the nurses, the physicians, the technicians, everyone in the healthcare industry who has just done an outstanding job of getting a vaccination to market and in people's arms in the time that they did. We're still fighting a pitched war, but this is like D-Day. We're going to win, but we're going to need your help.
Thank you, Dr. Payne. Any last remarks from the rest of the panel?
Vanessa, I just want to thank you for giving me the opportunity to reach out to our colleagues. And again, I work at the Windsor Street Clinic. If you want to reach out to me, I am on Gmail. Send me a message. I'd be happy to write back. I'd be happy to call you and talk to you.
Thank you, Dr. Agnes Graves. Anyone else? Last remarks?
I did my part, and I invite everybody to do their part. And I think we can go back to a normal life if we take the vaccine, because the COVID vaccination is a community effort. So I'm waiting for you guys to join the club and take the vaccine.
I just want to add, we say in Brazil, hug the vaccine. So if you hug the vaccine, you're going to be able to hug others in the future, in the near future.
Yeah.
And if you have any questions, if you want to have, these questions in Portuguese and Spanish, I'm here to help as well.
Thank you, panelists. So we'd like to take the time and thank all of our panelists tonight for joining us and sharing their experiences. After this session, we'll likely be sending this recording to all of employees with some additional resources attached to the email. So look out for that information, and please share with your family and friends the recording. The more we can get this information out to the community, your family, your friends, the better, to help debunk some of these myths that are out there and just the correct information. So I'm really hoping we can kind of spread all of this information and the word out there to improve our vaccinations, not just with employees, but our communities as well. So thank you everyone for being here tonight. We really appreciate it. And until then, have a good evening.
Thank you.
Thank you.